a misconception that spicy food and coffee cause peptic ulcer disease. Find out from this video all you need to know about peptic ulcer. I am Nurse Victoria and welcome to Health Education Series with Nurse V.
This city never sleeps. I hear the people walk by when it's late.
Peptic ulcer disease is a condition in which painful ulcers develop in the inner lining of the stomach or the first part of the small intestine called the duodenum. The inner lining of the stomach serves a protective function, but when there is an increase in the secretion of the hydrochloric acid in the stomach, it could lead to ulceration of that inner lining. The major cause of peptic ulcer disease is a bacteria called Helicobacter pylori. About 30% of the population are carriers of this bacteria, yet do not present with symptoms. After a long while, the bacteria sticks to the inner lining of the stomach, causing inflammation and possibly ulcerations. Hence, this mucous lining loses its protective function. Another cause of peptic ulcer disease is long-term use of non-steroidal anti-inflammatory drugs called NSAIDs, mostly pain relievers like aspirin, ibuprofen, naproxen, and lots more. Let's consider people at risk of developing peptic ulcer disease. First are long-term alcohol users. Alcohol can wear off the inner lining of the stomach. Long-term smokers, people with family history of peptic ulcer disease. The signs and symptoms of peptic ulcer disease include burning or gnawing sensation in the middle or upper stomach called the epigastric region, heartburn, nausea and vomiting, abdominal pain usually correlated with meal, feeling of fullness and bloating. There are two basic types of ulcers. First is the gastric ulcer, which occurs in the stomach. Second is duodenal ulcer, which occurs in the first part of the small intestine. The symptoms of these two types of ulcers could be similar, but the timing differentiates them. For gastric ulcer, the pain might be worse shortly after a meal because gastric acid production increases as food gets to the stomach. For duodenal ulcer, the symptoms could present 2 to 3 hours after meal. This is because when eaten, the pyloric sphincter, which is a muscle around this region, closes to concentrate the content of the stomach, hence preventing gastric acid from getting to the duodenum. After a while, when the sphincter opens and the content of the stomach goes into the small intestine, the pain worsens. The treatment measure of this condition is administration of antibiotics to kill Helicobacter pylori, the bacteria that is primarily the cause of the condition. Histamine receptor blockers, which are drugs that reduce the secretion of histamine. Histamine actually promotes the secretion of gastric acid, which worsens the symptoms of ulcer. Proton pump inhibitors are drugs that allows this wound to heal. Antacids, which is suspensions or liquid that primarily covers the wound. Prevention of peptic ulcer disease includes quitting smoking and alcohol abuse, quitting self-medication with pain relievers, or always contacting a medical practitioner for proper prescription of pain relievers. Thank you for watching this video. Give the video a thumbs up, share and comment. I'll see you in my next video.